Hello and welcome to Global Outlook. I'm Mary Sitt. We're coming to you from our homes during the middle of this coronavirus pandemic. U.S. deaths from COVID-19 have topped 63,000 people at the time of this recording. Experts say we need readily available testing in order to identify those who are infected so we can treat them, hospitalize them, and take care of them. Well, now there's a new affordable drive-through COVID-19 testing going on by Hope Clinic. And here to tell us more about that is Dr. Andrea Caracostis. She's the CEO of Hope Clinic. Thank you so much, Doctor, for being with us.
You're welcome.
So tell me, how does this drive-through testing work now? Can anyone go up there and get tested?
That's right. We're trying to expand the number of people that are being tested by opening the testing to everybody, whether you have symptoms or not. We always want to prioritize people who are feeling sick or very concerned or have been in contact with someone. So there is a short survey that you do have to fill out online. You can look it up on our website, hopechc.org. And you can just come to the clinic. We'll do the swab for you, and it takes about 2 to 3 days to get back the test into our hands. You can also get the test on an app that belongs to the clinic.
Now, Dr. Caracostis, do you have to have insurance to have the test, or can uninsured also go up, and how much would it cost?
Absolutely. The test costs $60 if you're uninsured, and you can pay at the time of your appointment, or and if you have insurance, then we will bill your insurance. If you cannot pay for the $50, then we have mechanisms to waive that fee. You just have to call the clinic and we will work with you. We want to make sure that everybody who is concerned gets tested and that we improve those testing numbers for our community.
Why is testing so important? Why do we need more and more tests these days? I mean, in order to really handle this properly?
Well, we need to know the denominator of the people who are infected, right? We don't really know how many are truly infected because we have only been testing those who are sick. And as you very well know, there's a lot of people who are either mildly sick that never get tested or have been exposed, like family members of people who have been exposed, physicians, nurses, medical students who are exposed at their sites, yet because they're not symptomatic, they have not been tested. Little by little, there are newer stations open for all who are concerned and want to get tested, and we're just one more of them. So we're way behind on the testing curve, and this is our way of doing giving our 5 cents to improve those testing numbers.
Now, up until very recently, you had patients or people who were concerned had to go through this whole litany of tests. Are you this? Are you that? Is this symptom right? Do you have a fever? Do you have a cough? Do you have tightness? And go through the screening before you're even allowed to be tested. Are you saying these have been relaxed now and people don't really have to go through that?
That's correct. We have relaxed many of those questions. And the only reason we do ask some of the questions is because we want to know who is coming through our doors, right? So if you're really coughing and symptomatic, maybe we want to put you at the end of the day instead of exposing more people to the infection. And also we want to direct you to the right resources that you may need if you're sick. So if you are symptomatic, we may want to have you have a televisit with one of our doctors before you show up so we can expedite your test and all that. So I think that everybody who can get tested can get tested. However, we do want to know who is going to come through our doors or towards our cars.
So you don't have to be exhibiting any symptoms at all. If you're just concerned and you think, I think maybe I was exposed. I don't know. I just want to be tested to be sure. It's okay then.
Absolutely. Let me tell you an example. A person that got infected worked at a call center, and they had 15 other people working at that call center. None of them were symptomatic. I don't think we need to wait until they start coughing to get tested, right? So the sooner we can test them, especially all the contacts, the better we will know how and keep people out from the public and safe at their homes if they are infectious. So if you had a coworker, you've been working with them for 2-3 days, and you're concerned that you may be infected and you have no symptoms, and come and get tested. We want to know, and I'm sure you want to know as well.
If you're insured, the insurance will pay for only one test?
No, the insurance will pay for as many tests as you need, right? So if you are infectious, we will require to stay home for 14 days. And when you return to work, you need two negative tests to go back to work. So the employer is going to want to know, are you healthy now enough to return to work? Are you still infectious? So your insurance will keep paying for those tests, and we want to make sure that you get tested as well.
Now, do you need an appointment to drive through there or how does that work?
You do need an appointment, just for, we don't want to be orderly, and you can get the appointment online and your slot online, just like you do with Walgreens or any other provider of care. And there's a specific hours for the test.
Now, Dr. Hope Clinic is a unique clinic. You offer services in how many different languages now to your patients? Dozens.
That's right. We are unique in that we provide care in 25 different languages. We are located on Bel Air and Corporate Drive, which is right next to Beltway 8, Bel Air and Highway 6, and Westheimer and West Houston Boulevard. We provide also free prenatal testing. We want to make sure that women have early access to prenatal care. So if you're worried about being pregnant, you can just call and come and pick up a pregnancy test at our clinic for free. And so we deliver babies as well, so you can immediately meet your OB, and then if we have a baby, we have a team of pediatricians, so you can just stay at one place, not have to make several appointments. So really try to be one place shop.
One-stop shopping, right?
One-stop shop, there you go.
And this is wonderful if English is not your first language, because you have so many people on staff who can speak so many different languages, right?
That's correct. We speak Arabic and Chinese and Vietnamese and Swahili and other languages that people are, when you're sick, you kind of revert to your mother language, and not only the language, but also understanding the culture and your sensitivities. And
you serve the uninsured, the underinsured, and also full service clients with good insurance too. You want those patients, right?
That's correct. We serve on a sliding fee scale. That means that we look at those who make less pay less, and those we take care of insurances. We take Medicare, Medicaid, and all private insurance. Our goal is really to provide seamless care to everybody, regardless of their ability to pay and regardless of their culture or income, so that when you walk in one of our clinics, you don't feel like this is the clinic for the poor, or this is only uninsured. You really feel like it's just a doctor's appointment, and you're respected and like anybody else.
That's great. And we can find out more on your website.
Absolutely. Yeah.
Thank you very much, Doctor, for being with us.
You're welcome.
We need to take a little break right now, but when we come back, we'll find out how HCC is reaching out to students in innovative ways during this uncertain and anxious times. Stay with us.
This is Ronik. She's a mom with a physics degree, so she understands the power of momentum. And she knows that by learning English at Houston Community College, she'll be unstoppable. HCC, for everyone, anytime.
Colleges nationwide have had to pivot quickly to reach out to thousands of students during this COVID-19 crisis, and Houston Community College is no exception. HCC has been lending out laptops to students, giving out groceries, and doing virtual counseling. Here to tell us more is Dr. Rima Adil. She's the Dean of Student Success at Northwest College. Thanks so much for being with us. Dr. Adil is known for her diversity, what she brings to the table in terms of her different ideas, and she's also received HCC's most prestigious award, the Chancellor Eagle Award in 2013. So thank you so much. Tell us, what is HCC doing to help students out during this very strange time?
Yes, hi Mary. First of all, it's good to see you today.
Thank you.
And yes, HCC has been doing, we have to keep in mind a lot of services because all this happened so quickly, and just to make sure their emotional health and if they are technically ready. Thousands of students were taking face-to-face classes that we have shifted them over a 2 weeks period online. So not knowing if, first of all, their technical skill set, the availability of the equipment, and also our faculty. So I think they have done a wonderful job. They did surveys to ensure that all the students have technology. We have provided them with some emergency funds to purchase their laptops, and connected them with their counselors, with their advisors, so we can personally learn what their specific needs are.
What are the major concerns, Dr. Adil, that students are telling you about? Or what's their main thing they're worried about?
Well, it depends. If they are currently in the class, the main concern is still just getting acclimated to online environment. A lot of students, they're saying that we signed up for face-to-face class because we didn't have the right learning environment at home. They may be there with their kids. A lot of families sharing the same piece of equipment, one laptop, or just doing homeworks and exams on the phone. So even though we have made the technology available, it was still a process. So you receive funding, then you purchase funding, so that can take another good 2 weeks or whatever. So yeah, that is for the continuing students. For new students coming right from high schools, I think they are a little emotionally upset because how everyone looking forward to their proms and their graduation. So yes, they're a little down, but we are working with the help of counselors and high school counselors to
HCC has really changed the way it's grading its students during the spring semester. Can you tell me about the grades and how that's changing?
And yes, that is a very important topic because a lot of students, they want to know what it is. So basically what we are doing is you stay in your regular classes or throughout the semester and finish your classes. Once your grades are posted, at that time, you will have an option to decide either you want to do a pass-fail. So what pass-fail does is it has no GPA consequences. So our international students or veteran students or students who are receiving financial aid, the A through C is fine, but when it comes to D and F, it is not fine. It affects GPA. So both a grade of pass, that will be a letter symbol of P, and grade of fail that will show on the transcript as NCR, no credit. So it's better to have no credit than to show F on the transcript. So I think that is wonderful if a student can understand their options and make an informed decision.
So if you have an international student coming over and that student is receiving certain aid or whatever, they need to at least pass the course to continue, right?
Yes.
So if they're making a D, let's say a high D, almost a C, it doesn't look that good, they can sit there and go, I'll take a pass-fail. They still get credit for the course. It says pass. It doesn't affect their GPA. So if they have a 3.0, it's still going to be a 3.0, right? With credit for that past course that just says pass, and they're good to go to the next semester. They don't have to worry.
One more thing about the pass is if they are passing the course, they will get the credit for the course that will count towards your degree completion. That will also count if it is a required prerequisite course towards the next level. So it's a good option.
It's got to be a huge relief for students, especially when they're adjusting to this whole thing. Maybe they're
struggling,
a sick family member. They're trying to find a laptop. All this stuff they're scrambling for. This is really good. Tell me about, what are you guys going to do for graduation coming up with HCC students? I mean, are you doing a virtual thing or what?
Yes, we are setting up virtual graduation. Again, some students waited for this day long time, and
they worked hard.
Especially when they are international students, they wanted to invite their families from back home, so they had plans. But this is what we are doing. So we are securing a virtual graduation, and we are asking students for their pictures and their regalia and the graduation caps, and asking for a message if they want to put it. So when we call out names, their pictures will be displayed.
Oh, that's nice.
Yes, and their little messages will be displayed. But they also have an option to walk the graduation for December. But right now we don't even know how things will be in December. But at least now we can say that
they have some sort of ceremony celebrating their wonderful achievement. That's great.
Of course.
And their family from across the world can look online, right? Tell me about the summer. What is HCC doing for summer classes now? Will it be all online?
So all summer classes are online, with the exception of courses that has a skill-based lab.
Okay.
Such as welding or electrical labs or whatever. Okay. Those are the courses that are not being offered this summer. And those are the only courses that students are receiving an incomplete this semester, in the spring semester. So what we are doing is we are anticipating some campuses opening for allowing the students to complete their grades from spring instead of piling up on incomplete. So we want to give those students opportunity to complete their grades. And then as of right now, the plan for fall, we are being told to prepare for the best. So we are preparing for face-to-face and online as usual. But then again, it will be dependent on CDC and city guidelines.
And if the guidelines are stay home, you just pivot to what you did during the summer, which was exclusively online.
Then
correct?
We will move the face-to-face classes online.
Now, what about students taking a life science, like a biology that requires a lab? Will they be able to do the lab in the fall? Let's say they're doing this in the summer.
Yeah, so for those life sciences, they have created virtual labs. So they are able to complete those courses, and we will be able to go through those courses successfully.
Where they're dissecting hearts, they don't have to smell the formaldehyde, right?
And it's
all virtual.
Yes, and their hands doesn't have to smell. Maybe they don't have to wear gloves and precautionary. So it won't be the same thing, but it's still something.
You are the Dean of Student Success. During this very unusual time, what are you telling students how they can be successful? What kind of tips are you giving them to just cope with all this?
Just hang in there and let us know if you need help. The earlier we know, the better we are in a position to help you. Just notify us. We have virtual lobby. The link to virtual lobby is online on HCC main page. You cannot miss it. The minute you are on the page, you'll see virtual lobby. Let us know. And there is a possibility that things may fall through the cracks sometimes, but don't give up. Just reach out again. And that's what we are notifying all our faculty, staff, administrators. Be compassionate, help the students out. So we all have the same goal and mission, vision. It's just that we just need to make sure that sometimes it's a volume of calls or emails that we are receiving. So it is okay to reach out again, but don't hesitate to just advocate for yourself.
And don't be embarrassed to ask for help.
No, don't be embarrassed.
Okay. Thank you so much, Dr. Rima, Adil, for talking to us. Appreciate it.
Thank you for having me here.
When we come back, we'll meet an exceptional student from Bogota, Colombia, who got stuck during spring break in Indiana. She'll tell us how she's coping.
Meet Saskia. She loves cars. Seriously, she whistles at them. So she's studying engineering at Houston Community College. After that, a 4-year degree. Then it's off to the races. HCC, for everyone, anytime.
I learned how to cook from my grandmother in the mountains of Oaxaca. Every time I need some comfort, I just remember what she told me. HCC definitely was a turning point in my life. What those wonderful teachers and instructors taught me is priceless. I have won many awards and worked in many restaurants. HCC was the window which opened the opportunity for me. For this wonderful city, they have given me so much. I will thank you from the bottom of my heart.
Meet Ekaterina. She has lofty goals to learn English and accounting. So she's studying for 2 degrees at Houston Community College, which means she's going all the way to the top. HCC, for everyone, anytime.
Our next guest is from Bogota, Colombia. Her name is Carolina Linares. And when she was on spring break visiting her sister, she got stuck. Tell me what happened, Carolina.
Hi, Mary.
Hi.
So, as soon as spring break started, I decided to visit my sister in Indiana. This is Columbus, Indiana. And my mom was here as well, so that's why I made the decision of visiting them and take advantage of the week off. But suddenly things got strange and I had to cancel my flight and everything moved to online. So I was okay with the decision of staying here, but still I was worried of how this transition was going to go with my classes and work as well.
Good thing you had your laptop with you on spring break, right?
Yes, I had my laptop here. I usually take my laptop everywhere, so I'm so glad I brought it here. So I have my workstation here. I make this for work, and I'm taking my classes online since they started that transition to online classes.
Now, how has that been for you, adjusting to online classes? Because most of your classes were very much hands-on, production, in person with your professor, right? And now suddenly it's online. How have you adjusted?
You're right. So only one of my classes was almost 100% online, which was the internship requirement. Mm-hmm. And my other classes were very hands-on projects. So a lot of videography and editing and group projects as well, because this is my last semester. So this is almost everything group projects for our finals. So it has been challenging because I have to meet with them through web, like we're doing right now, Zoom, WebEx, and so on. So many technologies that we're using. But it has been challenging because I don't have the equipment that I usually use at work. And for my classes as well, HCC provides all the equipment in the studios and the labs. Right. So it has been challenging, but also a very good learning experience.
So you're learning to do your interviews with Zoom, I guess, right? Because
yes.
You're still producing pieces for HCC, right? I understand you have a part-time job with HCC TV. Tell me what you're doing there.
Yes, absolutely. So with the students that we work together at HCC TV, we created a HCC TV remote report. Mm-hmm. So we decided to create some content of how all the students are coping the pandemic in their houses. And some of the pieces are external, so not only from the US, we have pieces from Colombia and so many places around the world, how people are coping this pandemic and how students are keeping up with their classes, and some other tips that we give to students of what things are working for us, like time management and the technologies that we can use to keep up with our classes and so on.
How have you been able to manage your time and, force yourself to study in certain hours and force yourself to do your work? Tell me how that's worked out for you.
Well, I keep a very structured schedule. So if I was going to work. So every time I go to work, I try to go very early if I don't have classes. And then when I go back to home, I have my schedule for school. So I'm trying to keep the same schedule that I used to have, but more structured. If I'm at home, I have a lot of I have to keep focus. So try not to get the distractions and keep lunch in a certain time. Don't try to move times around because that's not going to keep me focused.
Now, Carolina, when you say when you go to work, when you go to work, you're really at home going to work, right? I mean, you're in place. Is that right?
Yes. I mean, when I used to go to work, when I used to drive to work. So right now, this is just the room So over here with my sister, we have a room which is like our home office. So over here we just shut the door down and we do our work and our studies, and then when we're done we just move to the living room and so on.
These clips for HCC TV about the students. Tell me, why did you choose HCC in the first place? You could have gone just about any city, right?
Well, not only because it's affordable, but I wanted to get into the workforce and go straight to gain real world experience. So that's my goal over here with HGC. And I've heard so many good things from other students that also international as well, like me. So I moved closer to downtown, and that's like a very strategic part to live, since all campuses are like around Houston. So I go to Central Campus and I also go to the West Loop, and the distance is convenient to where I'm living right now in Houston.
What do you think about the professors you've encountered in your 2 years at HCC?
Oh, wonderful, wonderful. I have had previous professors with my advanced classes, so I get to know them very well, and they're so, right now, since everything is online, they are available for us to meet with them through the WebEx rooms and everything. Even if we don't have meetings for class, they are available. So they give us the opportunity to meet with them if we have any questions, if our software is not working, if they want to troubleshoot with us together. So technology has made it so convenient for us, and professors are so accessible that I'm really thankful for that.
That's great. Are you going to be one of those students who'll be graduating virtually? Is that right?
Yes, that's right.
I'm actually.
It was a little bit disappointing. Fun fact is that all my graduations, I have not walked. I don't know, so many things that have happened when I moved to Houston. I was finishing my high school and I didn't graduate. I didn't go to the ceremony because I had to travel over to Houston. So I have postponed the ceremonies, and I don't know why I decided to take this one in person, and suddenly this happened. But I'm so glad that I can do it virtually. And if it's possible, I could make it on December too.
Are you going to do a cap and gown thing and have your picture taken there?
No, I was not able to get it, but I'm trying to make it as professional as I can.
So hopefully you get to walk across the stage in December. What tips would you give other students who are in your position? Because you seem to be coping very well.
Well, like I told you, just try to keep up with the resources that HGC has provided. So professors are so available to us and all the questions that we have. So try to keep checking your emails. I try to keep going into campus daily to see if they have some announcements or new discussions, because that's how they communicate with us. So if I don't check that, I'm not going to be sure if they have new assignments or anything new. So I try to keep checking my emails, my Canvas, and everything daily to keep up with everything.
So stay in touch. Thank you so much for being with us. That's all for this edition of Global Outlook. We'll see you again every Friday and Sunday at 7:30 a.m. and p.m. plus Saturday at 10 a.m. Or you can go to our website at hccs.edu/podcast and download the show to go, or catch us on HCC's YouTube channel and get the full video version. I'm Mary Sitt. Thanks for joining us.